Good morning or good afternoon to everyone, depending on where you are joining us. Thank you so much for jumping on to our fourth webinar in our summer series over the summer. And if this is the first one that you're joining in our summer series, you might have missed our talks on the mid-year law updates that we did in June, end of June. We did some webinars on performance reviews and overtime, PTO, how to handle sick leave and vacation and the difference between those. So we've been doing these series throughout the webinar, or I'm sorry, doing these series throughout the summer of webinars, really to give you, I know that in summer, there can be some, I'm going to say, downtime with vacations or just kind of reworking your schedule going into the second half of the year. So this is a great time to kind of look at how things are functioning in the office. Is there some improvements you can make and some tweaks? And so as we've been going through these webinars this summer in our series, we now are at our retention webinars to really discuss the strategies that work and hopefully do not cost you more in salaries. And again, if you were not able to catch our webinars earlier in this summer, please reach out to us. Visit hrforhealth.com. You can catch the replays on there. We will be building on some of that content today to really look at, again, how do you keep your team without hopefully raising salaries? And again, while your employees definitely appreciate a raise, that's not always in the budget for you. And we're also finding that that's not always what they're looking for. You'll see in some of the stats that we're sharing is a straight up raise, it doesn't always move the needle for them, keep them there, or even work for people that you're recruiting. And so we want to look at how can you provide competitive benefits that attract good talent, keep your talent that you want to keep, but without costing an arm and a leg for you. And if you're skeptical about how that's possible, again, like I said, there have been a lot of recent studies that show employees really want complete benefits, and more would actually switch jobs because of an opportunity that has more complete benefits. And if you've heard me lecture or speak before, you've heard me say that when somebody asks you for a raise and you're not expecting it, there's a lot of stuff that probably has been happening underneath the surface that you're not aware of, because it's not just about an hourly rate for a lot of these team members that we're seeing in these studies and what HR for Health has observed. And I think a lot of you that are on this webinar, whether you're a current client or are not working with HR for Health yet, turnover is a anxiety inducing thing. I think more so than it has been in past years, because there is a shortage in talent that we're trying to replace these positions with. And so looking at turnover has really put focus for a lot of our clients of how do we stop this, because it is such an issue that's happening. And we know that turnover can cost 1.5 to 2 times sometimes the cost of an employee's salary, not just because you're losing that employee, you're having to spend time finding somebody to come in to fill that position, but also lost money in production, lost money in productive time from your existing team that maybe could be spending their time elsewhere. There's a lot of costs, again, around the recruitment, the onboarding, the productivity. And so we want to look at how can we reduce this. You know, we can't eliminate it completely. Sometimes things just don't work out, but how can you be as proactive and strategic with this as you possibly can? A recent survey by Forbes showed that 40% of surveyed workers would leave their jobs if another employer offered the same wage but better benefits. And then 10% would take a pay cut for better benefits. So clearly benefits are mattering to the workforce these days. Raises alone aren't enough to keep employees, which might make you feel a little bit better about this. If a lot of the money that goes into these salaries, of course, are really hard costs that can sometimes be hard to budget for, or it's just out of your budget. And so what we want to talk about today is what are some strategies that bring a lot of high value to your team in terms of that retention strategy, but not necessarily a high cost with that. And so this is what we're going to go through today. We're going to cover the basics of paid time off and some structures that actually reward loyalty. So the longer people are with you, the more that they benefit. And then some creative ways that you can use vacation time to support your employees outside of work. And then, since pretty much everybody wants to know where they're going with their career path and how they can get there and where they can go next, we're going to explore some strategies around some good job descriptions, performance reviews, some of those classic HR tools that sometimes can fall to the wayside, but can really be used to help employees envision real career growth with you and be invested in the practice to want to stay long term. At the heart of it all, employees do leave most of the time because they don't feel valued. Again, when an employee is asking you for a raise, there is a lot of times where it's too late. There maybe has been some, I'm going to say, damage that has accrued over time around employee recognition, them feeling rewarded for their performance. And so we want to help you to address that. And again, it doesn't have to be this huge, expensive investment, but it does also need to go beyond, once a year, a pizza party, lunch and learn. So there's a balance there, there's a scale, and we're going to talk about how to get there. And then employees are thinking about their health and their future. So we're going to talk a little bit about how bringing in some more comprehensive benefits like 401k and health insurance, why that's important and how it really is expected by a lot of candidates. This is something that's a top priority for today's seekers of jobs that are coming in through your ads you're placing, looking for new positions. And sometimes that's more important than their salary in the first place. So we also have some pretty exciting announcements. If you're an HR for Health client, that is going to be very exciting for you. But also if you're not a client, some sneak peek for you about some new integrations that we released. So that will be towards the end. And then, of course, Q&A. As with any webinar, if you're listening to this recorded or maybe you haven't thought of your question yet, feel free to always reach out to us at hello@hrforhealth.com with your questions. If you're on this webinar live, you can submit your questions through the Q&A box. If we're not able to get to them, we will absolutely follow up with you individually. So please feel free to submit your questions. Again, whether it's on this webinar live or after the webinar, we will definitely do follow-up to make sure you get those answers. So first, let's talk about paid time off or PTO. Time is valuable to all of us, and that, I know that in our industries, in dental, in opto, in vet, in chiropractor, in med spas, the work doesn't stop. Patients are always coming in, and your employees are all working really hard, and they deserve a break. And there's some ways that you can work that into your schedule to help to give your employees some relief. And it's really about making time for time off to be able to happen. Again, you don't necessarily have to raise salaries, but if you're a little bit smarter with your time off strategy, that can go a long way. Because I think, I've been with HR for Health for over 11 years now. I know that I remember when I first started with HR for Health and talking with clients, vacation wasn't necessarily the norm. Maybe we gave some sick leave hours here and there, or sometimes we didn't offer anything at all. And that was really the norm. We're out of that phase now. A lot of states have passed their own sick leave laws to try to put a little bit of pressure on employers to make sure employees are able to take time off when they need it for sick reasons, to take care of family members that might be sick. And so we're seeing these trends as becoming the law and needing to abide by that, but it also can be seen as a strategy, because a lot of our clients now in 2025 are coming to us saying, hey, my employees are no call, no showing. We're hearing a really high uptick in that being more the norm of, I have a really great employee, but then they just don't come in on Monday when they're scheduled to do that. And that can be super, super frustrating. And it can feel like you are just having to be reactive with those situations. And how do you really, again, find good employees who are going to be in the office all the time when you need them? But also on the flip side, I think that it's important to look at those no call, no shows, those people that you're having, again, that might be your A players or even your B plus players that you're like, I think they have a lot of potential, but they're just not coming into the office a lot, or they're calling out unexpectedly. That can be absolutely an indicator of burnout. Burnout is on the rise again, especially in what we're doing. COVID was really tough. It shifted the job market a lot. It shifted our practices and how they were functioning a lot. And so I challenge you all to look at that, of if employees are calling out here and there. And this doesn't apply to everybody. I know there are some employees who just aren't up for the job or not coming in, and that's that. But the ones that you really want in the practice that maybe again are calling out last minute, look at that as an indicator of potential burnout. Not that they don't want to be at the practice, not that they don't want to do a good job, but that they maybe feel like they can't be 100% and come into the practice. And so that's where your PTO policies can really be a good strategy for you. And the other part is, yes, we've talked about in a lot of states, it's legally required to offer some sort of paid leave, again, around sick leave. If you were not on our sick leave and PTO webinar, that's something that I would highly recommend you go back and look through and listen to. We talked a lot about strategies there. But outside of the legal part, the truth is almost all employers now are offering some sort of PTO, and employees expect it. So 1 in 5 job seekers would decline a job offer if it didn't include some sort of PTO. So everybody wants a vacation sometimes, but again, also sometimes things happen. People get sick, emergencies come up. And so having some sort of flexibility for the employees to be able to take time when they need it is going to make them happier and more satisfied. So that doesn't necessarily need to look like a raise. Again, either you're paying them for that time in the office, or you're paying them to not be in the office and be able to take some time away. So this is a way that you can kind of keep your budget intact with what you are already allocating towards salaries, but hopefully be able to offer them some time off. And again, it's not necessarily the cheapest retention strategy. I will say that, because you have to sometimes pay to have a temp come in, but it also can be some of your strongest, smartest strategies so that you're not having to deal with that turnover that we talked about in the beginning of this. So of course you have to deal with finding that coverage, but if you have really strong, clear policies around how far in advance they need to request PTO, what are the reasons that they're allowed to request PTO, and making sure it's clear in your policies that multiple people aren't able to be off on the same day. Is it first come, first serve? Be really clear about what that is so that you're not finding that costs are unnecessarily compounding with that. And that you're able to really have a plan with the team of, okay, if you have to be off, I see really clearly I have this temp that I'm going to bring in because you gave me a month in advance that I knew that you were going to be out of the office. So that can help to, again, be able to get yourself in front of that and not have it be the day of they're calling out and then you're scrambling to find coverage for your patients. Because again, if you look at it, they're taking those days off anyway, right? They're just not coming in sometimes. And so if you have this strategy to know and to encourage people to take their time off in a structured manner, it helps for you to get in front of that a little bit more. And we also see that when employees take time off, they are coming back being more productive after that break. And so it really is a good investment to make sure that your team is getting some time off, and hopefully you're getting some time off too. As practice owners, we get questions a lot, like, if I want to close my office for 2 weeks during the summer for my vacation, can I have my team also take their vacation time during that time? And the answer is absolutely yes. Again, if you have more detailed questions, I would highly recommend going back to look at our PTO webinar or submit your questions here to our team. We can talk through some strategies, but you can absolutely do that. You just want to make it really clear in your policies. Have this in writing, make sure they're aware of what your strategy is around it. But if you're not offering any sort of PTO, I think that's really a big takeaway that I would recommend you kind of digesting and thinking through. Of most employers are offering it, and it's really important that you're able to incorporate something into your offerings to make yourself a little bit more competitive with the employers that are around you. And there's a lot of ways that you can structure PTO. And when I say PTO, that's paid time off. That can mean straight up PTO, which is just that definition of paid time off, meaning Doesn't matter if you're off for a sick day, doesn't matter if you're off for vacation, it's all out of the same bank. Or you can have those separate policies of a sick leave policy versus a vacation policy. So when I say PTO, it's kind of just a general statement around that paid time off depending on how you offer it. But there's a lot of ways that you can structure it. And one of the most effective that we see is rewarding loyalty in a tiered system. So what that means is that you're offering more paid time off to people who have been with your practice longer. And that helps to clearly reward for their long-term commitment. So you can use tiers as milestones, meaning from 0 to 1 years, maybe they get a couple days of vacation time. You want to ramp them up to really see, are they going to be loyal? I don't want to give them all this vacation up front and then have them take it and then bail on the practice. And again, one way you can get in front of that is offering PTO or vacation or sick on accrual basis, meaning they earn those hours as they work. So they're not getting all of that right up front. But then also, as they've been there longer, once they hit after their first year, maybe in the second year, or even their third year, they increase in how many hours they're able to accrue. So what we do see as kind of common structures is the first 0 to 1 year is maybe when they get the least amount. And then 1 to 5 years is when you really do increase the tiers that they're able to earn towards. Then 5 to 10 years is another tier that they go into to be able to accrue. And then 10 plus is kind of a different, cap, if you will. 10 plus years is, all right, maybe you might be accruing up to 3 weeks or 4 weeks by the time you've been there for 10 years. And so that's showing the new hires when you're able to list that out, or people that might be on the fence about leaving. If they stay, they can get more time off. They can get more benefits in return from having longevity with the practice. And not to mention, the people who have been there for a long time, they might be tired. If we're looking at people who have been with you for 9 years, 10 years, they've been through a lot with the practice at this point, between pre-COVID, during COVID, post-COVID, and now kind of this new age that we're in where a lot of people are using temp employees as a strategy. And your seasoned team is like, okay, we bring a temp in, we're kind of having to show them the ropes. We are also the anchor for a lot of our patients. We're familiar faces. They really love us. I feel like I've earned some extra time in return. And they're right in feeling that. They've been with you for a long time. They have earned potentially some extra time to rest and recharge. And so treating your vacation and your sick or your PTO as a benefit that they've earned, you're really giving them that chance to disconnect, relax completely. And when they come back, they're recharged. And again, it's showing them that they have something that as they work, they're earning towards. So we really recommend, if you're just doing blanket vacation, sick, PTO, it's the same for everybody. Really recommend having that be a strategy that you look at. And again, if you are going to do this, if you're going to roll this out, work with our team in terms of, all right, what does this mean for my existing team? If you have right now, let's say just everybody gets the same, and you're sitting here going, yeah, wait, I've had employees here for 5+ years. Maybe I want to carve something out for them where they're able to get more time off as they work longer. Work with our team on how that would affect your existing employees, so we make sure that it doesn't have too much of a negative ripple effect. They see this as a benefit for them. And all that really comes down to is really clear communication of what the policies are. Of course, you want that in writing. You want to update that in your employee handbook. And then you want to make sure that what you have in writing is accurately reflected in the tracking in your HR for Health account, or if you're not a client, whichever payroll or time off system that you use. So just make sure that's really clear if you are going to make adjustments, but it definitely can be a good strategy. And then kind of outside of leave policies, or I should say outside of just typical vacation, sick, PTO, you can actually kind of bring a little fun with it. Having these creative policies or specific leave policies aren't too costly in the grand scheme of things. And it shows that you care about what your employees care about. So one way to do this is mental health days. Everyone has days where they are just not able to function the way that they usually are. They maybe aren't sick in a contagious way, but they definitely aren't functioning 100%. And so offering mental health days is a way to give people the day off, no questions asked, no judgment. They can rest their minds. And even, maybe it's you offer mental health days and that's part of your sick leave policy where they're using sick hours for that mental health day, but just even calling out that that's something that is offered is a great way to show them that you care. But again, make sure that you're clear of how do you want them to communicate with you if they do need that day off? Do you need advance notice, or are you okay with them just that day making that decision? Again, it really is up to you and your practice. These aren't required days off that you have to offer. So you do have some flexibility in how and creativity in how you structure it. But looking at, does it seem like your team is burnt out? Are they calling out last minute and people that, again, you really value and isn't necessarily normal behavior for them to do? Mental health days might be a good thing for you to consider. Another thing, offering birthdays off. This is something HR for Health does internally. I can tell you it does not break the bank. It's also very predictable. You know when your team's birthdays are, or I hope you do. Again, HR for Health tells you when it's somebody's birthday, so you can wish them happy birthday, but you can also anticipate and really plan, okay, yeah, you can take your birthday off. If heaven forbid your entire team happens or half your team happens to have the same birthday, work with them on, how you would schedule that out. But this allows, again, for somebody to take their birthday off. No pressure. It's just one day, but it can really go a long way with your team because let's face it, nobody really wants to work on their birthday. So this allows them some flexibility there. Um, if you're active in your loyal community, or if you're partnered with an organization that does really good charitable efforts, volunteer days are also a really nice way to support those values and support your team to going and helping out in their community. Again, those events are typically really structured. It's something you can plan in advance, but maybe it is giving them a couple days off a year to specifically be involved in the local community, to specifically be volunteering on those days based on what is near and dear to your heart, what the practice values, what they value, so that they can be able to feel fulfilled of contributing to what's going on around them. We've also had a really high uptick, believe it or not, in our clients asking us about paternity, paternity days. So if you're a pet lover, if you have a pet, if your team has a pet, it can be challenging to adopt a new pet, staying up late with that puppy or whichever the pet might be can really be depriving. And so we had our clients ask us, hey, my team is asking me to give them paternity leave. Is that something that I can do? And so the answer is yes, and it actually gives your employees kind of a chance to bond with their new pet and take time off to train them. If some of you are rolling your eyes at me, that's okay. I'm just telling you what our clients have asked us a lot of, is that something that I can do? And so I think looking at this last bullet point of inserting your ideas here, it's a nice segue into that of really looking at, take some time, take a step back of what does your practice value? What does your team value? I'm a big proponent in doing employee engagement surveys for this exact reason, to understand what does your team value? Where would they like you to spend this extra money or this allocated money for benefits? Is it that they want you to cover for them a professional organization dues? I want to be part of this office manager association and I want you to cover my dues to be able to do that. That might be really important. Or maybe they want different systems or softwares or something to make their job easier so it helps with that burnout. Those are things that might come up, but also really getting a sense of, are mental health days important to you guys? Do a lot of you have pets or are you thinking about adopting a pet? Like, it just helps with that communication so you don't feel like you're going in blind of guessing what your employees might need. And also, how does that align with what your practice values? You might want everybody, let's say you're a dental practice, you really want everyone to get their 6-month cleanings in. Offering, that as, hey, we cover your dental visits and we will reward you guys for making sure you do that within the twice a year, and we're going to, again, totally cover that. We'll cover it for your family. Like, there's a lot of possibilities. The possibilities really are endless. But after you go through and you make all these decisions with your team and with yourself of what you want to offer, that's where you really want to bring that to HR for Health, so that we can make sure, A, it's not complicated, but B, that everything's in writing, it's really clear, so that you as the employer don't feel taken advantage of, or, you feel like, hey, I'm really trying to get creative and offer you these things, but I feel like you're finding some loopholes. That's where we want to make sure that everything is in writing, it's really clear, and it's really, the team knows how they're able to use these days, who is able to use it, when they're able to use it. And so that's all going to be in writing in your employee handbooks. We can do some addendums for you. Or if you haven't updated your handbook yet this year, you have to do that anyway. So this is a good time to do it. But then we're going to build that tracking into HR for Health. So it's really clear in their PTO balances that they know how many hours they have available. They're able to request it in the system, even if it's not a sick or vacation day, if it's a day for their birthday, if it's a day for paternity leave or volunteer day, that's really clear in the system. And then you can review and approve those requests in real time. And then again, it's all pulled into that employee scheduler. So you're able to see, oh, this person has this day off. There's now a conflict. I have an open shift. I need to make sure I schedule a new person, bring a temp in, whatever it might be. So again, all these ideas that you have, just make sure you bring them back to us so that we can help you to structure them, have it be really clear. All right, so aside from work-life balance, one of the biggest reasons that people leave is uncertainty. So if your employees don't know what's next for them, they might start looking elsewhere. If they don't feel like they see how they fit into the practice's goals long-term, that can create some unease for them. So by creating a picture where they know exactly where they stand and they can visualize, they understand what the next step is for them, they're more likely to stay and be engaged and do their best work. So the trick here is going to be communication. And I know that, again, in the practices that all of you are working in, they're very fast paced. You're probably thinking to yourself, Jill, I'm already understaffed. I'm already trying to get more people in here. I don't have time to do a performance review. And so I want to, again, challenge you to kind of weigh the pros and cons of that. You're completely right. There is a lot going on, but you also want to make sure you're really taking care of the people that you currently have on your team, so that they do want to continue to come back to work for you. So a lot of employees do want regular feedback on their work, but a lot of them are not getting it. And so this is where you really can and should approach this problem with a mix of formal and scheduled performance reviews and then just regular check-ins. So I'm a big proponent. Again, you probably heard me say this before if you've been on our webinars, but you should be checking in with your team at least informally once a week, one-on-one. Hey, how's it going? Asking questions like, how can I help you? What's going well right now? How can I make your role smoother? How can I make your day-to-day smoother? Am I doing what you need me to do to be able to support you? And sometimes there's not a lot to talk about because things are really going well, but you still should have these conversations because positive feedback is still feedback. The other thing is that it makes, if something is not going as well, it feels less of a sense of anxiety for both you and the employee when you have to have those check-ins because they're already regular check-ins. So it doesn't have to always be things are going great, but if you're used to checking in each week and something pops up that might be a little more uncomfortable to address, at least you're not also having to overcome the hurdle of even calling them to have that conversation. It makes it feel that much more stressful if they're not used to it. So again, those regular conversations make that much easier. And then it also makes that performance review process a whole lot easier. So performance reviews are more formal. We recommend at least when somebody comes into the office for the first time, you hire them at least 30, 60, 90-day check-ins that are more formal, that have that documentation. That's going to help you through that introductory period or probationary period that a lot of people call it. But then therefore at least, or thereafter, at least once a year, if not twice a year, And the way that we recommend that you do the reviews, again, HR for Health is notifying you, hey, it's this person's anniversary. You should probably do a performance review. We're doing that at least once a year for you. And so we're telling you it's time to do it. But then also the way that you're doing it in our system is an employee reviews themselves first. So the system sends it to them to review. They're going to go through a series of 1 through 5 like rating scales. So based on the question, 1 is I feel like I'm never doing this, 5 I feel like I'm always doing this, and of course there's a scale. Then they have a free response section where you're asking them questions. They're actually able to write out their thoughts. The system then sends it back to you as the reviewer. Again, if you're an office manager on this call, or if you're a doctor and both of you want to do that review together, the system can send it back to both of you at the same time. So you're both able to do your own review, but have visibility to what that employee reviewed. The system's then going to tell you, okay, it's time to meet. So you've done all that prep work beforehand. You're going to go through that review in person. It will allow you to make final comments. And then the last step is it's actually going to send to that employee to sign. So in this review, this is where you want to be talking about growth and career development and discussing specific areas for improvement and not forgetting to set goals. So the trick is to include both positive and negatives, but also showing a path forward. So what do I mean by that? I mean that if you have an employee who's doing something great, like maybe they're on time every single day, maybe it's even the little things, they never edit their employee time clock. They never edit their time clock. They're always clocking in and out correctly. Make sure to acknowledge that. But then also, if there are things that you want them to maybe set a better example on in different areas of their role to make a positive impact on the workday, you're also bringing in that. So if the employee isn't exactly accurate with how they're presenting treatment or how they're passing off a patient between teams when those conversations need to happen, giving those specific examples of what's not working and then setting goals on how to improve that can really help. Offer trainings, absolutely, if you need to. And then listen if there's anything missing from their perspective. There's a question in our performance reviews that actually asks, what can the practice do to better support you? And listen to what the employee says. You might feel like, we're already doing that. But if the employee is mentioning that in their review, it's absolutely something you should look at and think, well, maybe in my mind we're doing that, but maybe we need to tweak how we're doing it or make it clearer for the employee. So this is a really good opportunity to have a constructive conversation and not just walk into those reviews where an employee's like, great, it's my review, I'm going to get a raise. The raise could come, but you're able to have that objective conversation about the performance first. And this is something that is a ongoing thing. A retention strategy is constant, but it actually starts before you even meet that first employee, because the first thing that you want to do is write a job description that really pulls them in, makes them want to join your team. It describes the work well. It's really clear about the requirements, and it mentions the benefits that you plan on offering. So be really specific. The clarity really sets the tone before day one. Again, if you're a client of HR for Health, you have all these descriptions already, these job descriptions at your disposal. So you can take those, you can use exactly what we have, you can edit them for these job postings if you would like, but once they're in the system, they're re-seeing that job description, reconfirming that job description. So it's setting that clarity right as they start. And then once they're on the team, that regular review cycle that I talked about in the last slide really helps to keep everybody aligned so that nobody's surprised. Again, I think one of the hardest parts about us bringing in feedback is it can feel uncomfortable if it's not the norm. It feels like, well, I'm not giving them praise when they're doing good stuff. I've let a lot of stuff go, but this is now too big. I have to address that, and it can feel really daunting. And so when you have that communication normalized from the very beginning, it really, really helps. And then putting a development plan in place. This is kind of an interim between a formal review, but also like an informal, just kind of check-in. That development plan allows you to hear from your team where they want to go, and that you're actually putting in place a plan in place of, okay, great. I see you're here and you want to get here in terms of your skills, in terms of your leadership, in terms of whatever it might be, your contribution to the practice. Here's how I'm going to make sure you understand how to get there. I'm going to give you consistent feedback and a clear path forward to get there. And that shows that you're investing in them and that they in return are much more likely to invest in you and less likely to look elsewhere for that. And again, we keep this all tracked for you in the system with documentation so that if anything goes sideways and not the plan that you're thinking, you at least have that documented so that it's easier for you to make an employment decision if you need to. But just don't forget that these check-ins can really make a difference and build that relationship between you and the team. Because again, this recognition that we're kind of going into, this culture driven retention that you want to be focused on, really can help to prove to employees that you're committed to them, because that loyalty goes both ways. I always say that culture is not a pizza party. Culture is how somebody feels about going into an office on Monday. How are they feeling about work on Monday is a good indicator of what culture looks like. And you've probably heard it said that people don't quit bad jobs, they quit bad management. And this is partly true, but at the core of that message, the real reason that good employees leave, even if they're earning a lot of money, is that they don't feel valued. They leave when they feel disengaged from their team, when they don't know how to progress or do better. They're like, I think I'm doing okay, but I'm not getting feedback. Or they might tell me I'm doing great, but then they're micromanaging me and the actions aren't aligning with what they say. Or above all, they don't feel like they're making an impact with their work. The generation of employees that are coming into our workforce and have been coming into our workforce want to feel valued. They want to feel like they are making an impact. They can see what they are doing on a day-to-day basis is helping the people around them. And the great thing is that by offering great clinical services, by really taking care of the patients, that does come into play and they can see that. But it also goes back into, but does my manager feel that I'm doing a good job? Does the doctor feel like I'm doing a good job? Because they want to feel valued. Money is a good measurement, yes, but people don't leave just because there's not enough money in their paychecks. They leave when they're not getting recognition for the work that they put in. And really, recognition is one of the lowest lift ways that you can retain your team. It's pretty much free, for a lot of the ways that you can address this. And there's a lot of solid evidence that supports this. Businesses or practices that have formal education, or I'm sorry, formal recognition programs have 31% less turnover. Their employees feel more productive and engaged with their workplace. They feel better going into the practice. They are more satisfied with the work that they do, and they're more energized and want to work with their team. They're less likely to call out unexpectedly because that is helping to contribute to their burnout. They feel like, if I'm not in the office today, I'm letting down not just my patients, but I'm letting down the team around me. At the same time, 1 out of every 2 employees want more recognition than they're currently getting, but only 35% get recognized on a weekly or monthly basis. And it really is so easy to say thank you. It costs you absolutely nothing. It takes almost no time. And it can be for big stuff like a 10-year work anniversary that you probably want to put more effort and time and maybe money into, but it can also be for the little stuff, like getting through a really tough day with a smile. Like, everybody is trying, everybody wants to be doing a good job. And so those little things help them to feel, when you're calling that out and really giving them a kudos, they feel seen, but you're also reinforcing the behavior and the talent that you want to see. These positive call outs reinforce that good team dynamic that you're searching for in return, because they're going to see each other getting praised for great work, and that's going to cause this ripple effect. So before you know it, hopefully you're going to have a happy team who they feel like they truly matter to the team. They are relying on one another and they realize that you value them. They're getting more work done. So at the same time, we know that a pat on the back doesn't pay the rent, right? They still have bills. And so there's a way you can be even further strategic about this, which is having some performance bonuses. So this can be a reward without raising base salaries, of course, and this can also be a cost-efficient incentive because you can budget for it in advance. So having merit-based pay raises, so not just, hey, you've been here for this, well, you made it another year, congratulations, here's a raise. If you're actually having that be based on their performance, like we talked about on the performance reviews and those check-ins, like you really have an awareness of how they're positively contributing and learning and changing based on your coaching for them, you can bring in performance-based raises. It does raise salaries, but it doesn't have to always be super expensive. But make sure if you are giving a raise that it is warranted. You're not creating an environment where it's just, again, you've been here for another year, great job, we're going to give you a raise. Another way to do this is if we're looking at bonuses. So big end of year bonuses can be great, but you can also do smaller perks throughout the year. So for example, if you're having a hard time meeting your patient care metrics, you can offer a small bonus to employees who hit their goals. And maybe that's, again, seasonal. If summer's a little bit tougher, you're putting in a fun team incentive of patient recall for the team for a certain metric, and then everybody gets, a little bonus. And this could be monetary, this could be you get a half day off, this could be a lot of different things, again, based on the creativity we talked about earlier. Or let's say your practice opens really early in the morning and has night hours, and your attendance and tardiness are a problem. We've seen this a lot of our clients starting to get creative of actually bonusing based on them following your attendance and tardiness metrics. And it's not a big bonus, but that small bonus for perfect attendance really can outweigh some of the struggles that you're having with people just calling out, because they see like, I don't want to, ruin my perfect attendance record with this little pot of gold at the end. So I'm going to, come in. These can be given as non-discretionary bonuses. So non-discretionary bonuses, again, if you have not been on our webinars before, I would definitely check out the overtime webinar we did a couple weeks ago. But non-discretionary bonuses are essentially, I know as an employee, I am doing X to get Y. So I know that if I am going to be, if I have 100% patient recall on for this month, I'm going to get a $50 bonus, then you just need to make sure you're calculating those non-discretionary bonuses correctly and that that's communicated with everybody. So if you have questions about how to do that non-discretionary calculation, please reach out to our team, watch our overtime webinar. We'll make sure that you have all that information. So again, a non-discretionary bonus is really an employee knows exactly what they did to earn that bonus. And non-discretionary or a discretionary bonus on the flip side can also be helpful, which is just, I'm feeling nice today, I'm going to give you a $100 bonus, but they don't know what they did to earn that. You don't have to do any special calculations with overtime for those types of bonuses. So again, talk with our team if you have questions about discretionary versus non-discretionary bonuses, if you're not sure which one you're doing and which calculations you need to do. But if you are planning on doing that, you want to make sure that you're calculating everything correctly. And then non-monetary bonuses can be helpful. So again, an extra day of PTO for whoever has perfect attendance during a busy season. Maybe you have some cute practice swag, or you have gift cards, or you want to do, you want to give somebody free lunch. These are always great ways to say thank you. Just be careful not to overdo it. You want to make sure that you're not replacing fair compensation in a healthy work environment with a pizza party, that there is that balance, but it is really nice to offer those things to the team. So again, just make sure with whatever plan that you have here, similar to the PTO, similar to the vacation, the sick that we talked about earlier, just reach out to HR for Health. Make sure that, again, if you're a client, if you're not, reach out to whoever is helping you, or again, reach out to us if you have questions on it. Even if you're not a client, we're happy to help you. But in the system, we have a lot of tools that help you to document these things, how to make sure you're applying these bonuses in a compliant way, and that everything is tracked and calculated correctly. All right, so now that we've covered some of the day-to-day ways that you can improve retention with some creative benefits, let's look at the future. So Retirement is on a lot of employees' minds, and it's easier than you might think. So again, a lot of candidates are now expecting a retirement package, specifically 401k, in exchange for full-time work. So this is a sign of a long-term working relationship for many. And also, retirement is expensive. Most people are not able to squirrel away enough from their paychecks each money to save up. The rising cost of living is happening. There's question marks around Social Security. There's this buzzword of inflation that we're all talking about. All of these things can make it a little bit more difficult for your team to save. But if you offer a 401k plan, you're helping the employees envision themselves retiring when they're ready. And you're really, literally, you're banking on their future, and they are too. You're helping them to reach their goals. You are incentivizing them to stay with the practice long term. And those employees who take their careers seriously want a 401k. Those A players that you're looking for, that you want to come in and be really loyal, this is a way to do that. Building up an employer match 401k can take time. But if you're offering that, you're helping them to save for their future, and you're encouraging them to stay with you longer. So for a lot of employees, the idea of retirement can feel kind of impossible, but this is a way to give them a real opportunity to save and plan for their future and help them feel more secure, and it builds that trust. And it also can help you as the employer of offering these things for your own 401k, because the reality is it can cost more than $1 million to retire, but the Federal Reserve estimates that a fourth of working adults have no retirement at all. And so that's why several states now have laws that require employee retirement plans, and a lot more have even proposed legislation. So this lists states that are requiring employer-sponsored retirement plans. Again, a lot of your states have these plans that you can enroll in through the states. And to me, that's good. It's kind of checking that box. But there's a way that you can be a little bit more strategic, again, with your own 401k and helping really give your employees a great plan by looking elsewhere besides the state offerings. And a few of the states are still in the process of rolling out these laws, but if you're in one of these locations and don't have retirement set up yet, you definitely want to look into it. Some of the states have minimum employee counts, meaning if you have 5 or more, then you have to offer it. But a lot of the states are putting in very low numbers as the threshold. A lot of them, even as few as just having 1 employee, means that you have to offer it. But the 2022 SECURE Act, which stands for Setting Every Community Up for Retirement Enhancement, now has a small business tax. So the small businesses can get tax credits for starting 401k plans and providing matching benefits. And the credit can be up to 100%. So if you have questions on this, talk with your CPA about it. We just want to call this out. If you're not totally sold on offering it and you want to consider it, there are some tax credits that you could earn from that. But also it helps, again, to reduce that turnover, because 32% of employees are less likely to leave if you're offering a 401k. So it really can reduce that because they feel supported to stay. So since so many job seekers are looking for 401k and consider them necessary for a complete benefit package, it's definitely going to position you in a stronger way when you are recruiting and trying to keep your employees than maybe some other practices. And so this is where we get to one of our exciting announcements. I'll talk a little bit more about this at the end, but we did, for HR for Health, just release a new 401k integration that makes setup and tracking super simple. So this is now part of our embedded payroll service, and we can make this setup really easy. So I'll talk about that a little bit more at the end. But again, if you're not offering this, or if you're thinking, well, I have the state-run plan, but maybe I could be a little bit more strategic for both myself as a doctor who's a high earner in the practice, definitely something that you should consider to look at. And then before retirement, employees need to be staying healthy. So affordable, streamlined health insurance is also a top priority for employees, for job seekers. And really you want your team to stay healthy. You want their families to be taken care of. So this is also something really important to consider. Employer-based healthcare is kind of the default in our country. Most full-time employees expect to see health insurance as a benefit offering. Even if they're getting coverage from another source, like their partner, their spouse, their parent, the marketplace, they will expect the opportunity to get coverage if they need it. So if they're a younger team member, they're on their parents' health insurance, they know they're turning 26, they're going to have to figure out their own option. Maybe they get divorced, maybe their spouse loses their job, whatever it might be. They also want that option if they need it, even if they're not opting into it right now. Because we're all in the business of serving patients. We are also patients ourselves. And the cost of healthcare is not coming down anytime soon. And sometimes these government funded programs aren't always applicable to your employees. So by providing these services, you're really you're prioritizing that wellness, and you're making a conscious effort to have these benefits to your employees, just like you would want for your patients. And as a side note, if you have more than 50 full-time employees, or full-time equivalent employees, you must offer health insurance based on the ACA requirements. So it's just a good thing to start to look at. And if you offer health insurance, your employees expect a certain level of quality and coverage. So choosing the cheapest option isn't always the key to cost savings. I was talking to the practice a couple weeks ago that were really, really concerned about their health insurance because they had a large number of employees. It was a multi-location office. And out of the hundreds of employees they had, only 10 people were opting into their health insurance offering. And so that really made them think of, well, maybe we need to go back and look at kind of what we're offering. And maybe it's not the best option. And do we need to revisit the way that we structure this? But it is absolutely something that you should be considering just to even get quotes. It's never a bad idea. Even if you're not required to offer health insurance, know that that's kind of the way of the future. And especially if your employees are asking you for this, or if you're offering it and you're seeing that people aren't enrolling, I would recommend looking into that a little bit further and seeing if your policy is the best one that you have. The good thing is, just like the 401k that I just mentioned, we did release a new integration on the health insurance management so that things are syncing into payroll, and you're able to onboard and offboard really easily for both of these things, which brings us into how we can help. So to kind of recap of what we went over, there's a lot of things that maybe you have on your to-do list to talk with our team about and get into play. Again, PTO, that creative time off that we talked about, rewarding that longevity, really important. Work with our team to make sure that gets into your employee handbooks, that it's tracked in the system correctly. If you're not using our job descriptions, if you're not using our performance review tools, put that on your list. This is a great time to start to get ready to do that on your next employee's anniversary. Putting in those recognitions for the team that help to celebrate the success and have that tracking is really important. And then, so if you aren't using those things, please reach out to our team so that we can help you to utilize those. And then learning more about that retirement, that 401k planning, the health insurance coverage as we bring this in. Again, HR for Health now includes 401k and health insurance integrations through two of our partners on the embedded payroll side. You do have to be on Gusto embedded payroll with us to even have access to the 401k and health insurance integrations. So if you are not on those yet, I would highly recommend booking a demo, talking with our team about it. Again, we have this new 401k integration. We have this new health insurance integration. For you that are clients, or I guess even if you're not and you're just interested to know how it works, we'll go through a demo with you. But essentially what this allows is that when you hire and terminate people in HR for Health, it's now going to automatically generate them to either enroll in 401k or enroll in health insurance or terminate them in one place for you. The deductions for 401k management, the deductions for health insurance management can all be integrated in your payroll if you do choose to use these solutions. The 401k, the money will be moved for you. So again, this is a brand new integration that we just released last week on our platform. This is how you can learn more information about it. You can scan this QR code to book a demo with our team. It will route you to the correct people based on kind of where you're at in your journey, if you're a client or if you're not. We'll make sure we get you this information. You can also call us. You can email us at hello@hrforhealth.com. We will be doing a couple more granular webinars towards the end of the year on really how the 401k and health insurance works. So this is just an introduction for you guys. Keep your eyes peeled for as we're doing more content on this. But again, this was really just to get you to potentially consider why it's good offering it. We are agnostic in this, whether you want to use our 401k integration or not. Of course, we want to make it easier for you to manage these things, but it's totally up to you. And yeah, let us know what questions you have. Jasmine, I know we're like right at the end. I'm not sure if we have any questions or if we should follow up with our attendees.
No, actually, I do not see any in the chat. If anyone wants to drop a question in now, you can feel free to do so. But otherwise, yeah, definitely direct any additional inquiries to our hello at HR for Health line.
Perfect. Yeah, we gave everybody a lot of ideas. So if you need to digest and kind of think of which one you want to start with first and want to, again, talk with our team about how do you even start to do some of these things, we are always here to help you, and appreciate everybody attending this session of our summer webinar series. It's crazy to think that we're coming near the end of summer, but be on the lookout for our upcoming webinars content. We are here to help you. Please reach out with whatever questions you have or support that we can offer.
Awesome. Thanks so much, everyone.
Thanks.